So I am Rebecca Furaha, and I am a medical doctor from the DRC, and I work in maternal health. I was born and grew up in a rural town in the eastern part of the DRC, and it is a part of the country with many armed conflicts. So when I was young, about 9 or 10 years old, my family and I had to flee to Nairobi. When we came back to our country after 5 or 6 years, there are many women health issues and there were no doctors to treat those women, and I became motivated about becoming a doctor and offer solutions to those women. In our context, abortion is illegal. So as our country signed the Maputo Protocol, in some cases, women can have an abortion. Those are in case of an incest or sexual abuse. But in practice, it's a great challenge because, first of all, that woman who has been raped, for instance, needs to go to a hospital and the doctor has to assess the abortion. The woman has to pay for that out of pocket. And I work in an area where many people live in poverty, so they don't have the means. The second part is they need to go before a judge so that the judge can sign off the authorization for that abortion. So we can't expect every woman to be able to afford that. So that's why in most cases, women just decide to take abortion pills on their own, or they even try to insert herbs or even clay in the vagina so that they can provoke abortion. And when they see that they are bleeding or they are having complications, most of the times that's when they come to the hospital. So it is very challenging. That's why it is important for women to have contraceptions. So globally, almost 50% of pregnancies are unwanted, and most of those are found in low-income countries where women don't know about contraceptive and they don't have access to contraceptive. So in Lotumbe, I was very moved to see how women in this part of Congo were openly talking about contraception, and this is thanks to the support of HandUp Congo, because women had been given information and they were taking the opportunity that was given to them. And I was so moved by that because we don't get to see that every day, especially in remote and rural areas like Lotumbe. I got an opportunity to discuss with women who had implants that had been provided by HandUp Congo, and these women were really very happy, and they were explaining how this contraceptive changed their lives, because today they are able to decide how and when they want to have children, and it's something that is really empowering.